Hello, my name's Amy O'Brien. I'm a licensed master social worker at the Beaumont Health System, Royal Oak. I've been in healthcare since 1988, and I'd like to talk to you today about a topic that often does not like to be talked about, but is very important that we do and bring awareness. Today I'd like to give you some information about elder abuse. Elder abuse is very prevalent, something that we don't want to recognize, but about 1 in 10 Americans over the age of 60 have been victims of some sort of elder abuse. And I'll talk to you today about what those types may be and what it may look like and how and what you can do about it. So just to give you an idea, elder abuse gets confused because you have to be a vulnerable adult in order to be a victim of elder abuse. Me, as a middle-aged person who gets slugged in the face, that's called an assault. That's not elder abuse. So it's very important that you recognize that it must be a vulnerable adult, and it's abuse, neglect, and exploitation committed against them. And that's somebody who's unable to protect themselves either due to physical capacity or mental capacity. The different types of abuse that I mentioned, physical abuse is harm or threatened harm to an adult's health or their welfare caused by another person. Neglect is the inability or failure of the adult or an individual responsible for the care of the elder or vulnerable adult to provide adequate food, shelter, clothing, medical care, those types of things to keep them safe and healthy. And exploitation is the misuse of an adult's funds, property, or personal dignity by another person. And typically we see that in financial. Oftentimes, the person who is the perpetrator of elder abuse is unfortunately somebody who is well known to them, either a family member or a close friend. There are different types of abuse to watch out for: physical abuse, sexual abuse, emotional abuse, financial or material exploitation, neglect, abandonment, self-neglect. And we'll talk about each of these in a little bit more detail. Physical abuse is the use of force that may result in bodily injury, physical pain, or impairment. Some things to look for that may be indications of abuse is bruising, burns, abrasions, or fractures. And these, of course, would be unexplained. For example, a bruise on the arm where they did not fall, bump, or otherwise have an explained injury for. Sexual abuse is non-consensual sexual contact with any kind with an elderly person. Some signs to look for may be genital or anal infections, difficulty in walking or sitting, and bilateral bruising to the inner thighs. And it's important to remember that oftentimes elderly cannot give a succinct history of what may have happened, which is why these physical signs are so important. Emotional abuse is the infliction of anguish, pain, or distress through verbal or nonverbal acts. And I think we do see a great deal of this in our elderly, mainly due to the frustrations that caregivers have in caring for them. It's hard to distinguish these signs because there could be physical, mental, or other medical problems that would contribute to this. But some things to watch for is watching the care providers and how they interact, threats that you may witness, speaking poorly to the individual, or simply ignoring what their needs may be. Financial or material exploitation, illegal or improper use of an elder's funds, property, or assets. This could be cashing their check without their permission. It could be taking their money or property. It could be coercing them or deceiving them into signing documents that would allow you access to their funds. And also diverting the guardianship or conservatorship assets if you are in that legal position and misusing. Neglect could be the refusal or failure to fulfill any part of a person's obligations or duties due to an elderly person. This one gets a little bit tricky because it could be unintentional on the care provider's part due to issues like they may lack the knowledge about what they're supposed to do, or they're unable to cope with the high demands. Signs to look for, again, neglected bed sores, skin disorders or rashes, untreated injuries or medical problems, poor hygiene, hunger, malnutrition, dehydration, pallor or sunken cheeks and eyes, and lack of clean clothing or bedding. Abandonment is deserting the elderly person. Somebody who has physical custody and is legally bound or morally bound to care for them, and they just are not, they leave them and do not provide care. Self-neglect is a little trickier. These are behaviors of the elderly person themselves that threaten their health and safety. And it could be any combination of the neglectful signs that I previously identified. That's usually you enter into the situation where adult children have to have conversations with their parents that they're just not able to care for themselves any longer, and that typically is a very difficult transition for both. Not all of our elderly are at home or with family members. Some do reside in institutions such as assisted livings perhaps, nursing homes, extended care facilities, and not all the care there is provided adequately. So things that you need to watch for are acts that are not permitted, that are not suggesting that this is a good environment. Abusive acts may include physically restraining patients, depriving them of their dignity, leaving them, for example, leaving them in soiled clothes or in compromised situations that would be embarrassing or humiliating, lack of choices over their daily affairs, intentionally providing insufficient care, for example, pressure sores, bed sores, skin breakdown due to lack of treatment or proper hygiene. Over or under medicating or even withholding medication, and emotional neglect and abuse that we referred to earlier, such as how you would speak to a person, making threats or damaging comments. It's hard to conceive that this does happen in this day and age, but there's been a lot of attention put forward in terms of why this does occur. There have been studies that have looked at these and found that victims of elder abuse are twice more likely to die than those not reporting abuse. Another reason could be our rapidly aging population. We're living longer. The resources just may not be there, whether it be facilities, level of care in facilities, or families having to provide the care on their own. It's predicted that by the year 2050, the global population of people aged 60 years and older will more than double, from 9 million last year to about 2 billion. Some of the risk factors to be aware of are individual, relationship, community, and socio-cultural. And I'll talk about each of these individually. Individual could be that the elderly is in poor physical and mental health, which makes them more of a target for elder abuse. They may have mental disorders or alcohol or substance abuse in the person taking care of them, which gives them a less tolerant level of functioning with the elderly. And women, unfortunately, have been noted to be at a higher risk than men. The relationship within the elder's environment, you now have older parents perhaps living with their adult children, or vice versa, the adult children have to come live in the parents' home. They are more dependent on their care providers. Oftentimes it is financial. You hear fixed income frequently, that our elderly are living off of just a Social Security check. There's no pension, there's no other monies coming in. The family relationship may not have been strong in the first place. If you've got a poor, say, mother-daughter relationship all growing up, it's not going to be a whole lot different when they're older, and that then can create problems in terms of making them more vulnerable to abuse. The stress of having to care for the older person as they become more dependent on you is a factor. And more women are in the workforce and staying in the workforce longer, so they don't have that spare time any longer. Growing up back in the 50s, moms stayed home, dads went to work. Nowadays, everybody's working, and you don't have that capacity to be home and care for an older parent. Within the community, sometimes there's some social isolation. If either the caregiver or the elder is in a isolated situation and they're lacking the support, that makes them vulnerable. Perhaps their physical or mental capacity, which isolates them, makes them vulnerable. And losing family and friends. As people are living older and older and older, they may not have family and friends around that are able to care for them. There are some sociocultural issues as well. The elders are often viewed as frail, weak, and dependent. The erosion of the bonds between generations, as I referred to previously. Systems of inheritance and land rights affecting the distribution of power and material goods within families. That could create friction, it could be unbalanced, and it could create situations where the elderly just are not tended to as they should. And migration of young couples. Everybody is having to maintain their own households, care for their own families. They may not be in the community where they grew up or the community where their parents are residing. And again, lack of funds to pay for care. Even though you're not able to be home with them, you may not have the financial means to provide care on a private duty paying basis. Some other things to keep in mind. You hear they're in their right mind, they're not in their right mind, they have, are they competent, aren't they competent? And there's some misnomers in there, and I just want to clear this up slightly. This could be a full presentation in and of itself. These words get thrown around loosely and oftentimes are used interchangeably, and it's not completely accurate. So capacity and competency are often used interchangeably. However, the difference is important. So let's look at what the difference is and trying to keep it simple so that we all can understand. Capacity is being able to make your own decisions. It's a fluid concept. For example, you may have heard sundowners, or my mom doesn't do well in the evening. In the day, she may be perfectly fine. So if you ask her during the day, what would you like? Would you like medical treatment? Would you like care? Would you like to live with me? Would you like to stay at home alone? They might be able to answer you. In the evening, however, they may not be able to answer you so well. So just keep in mind that that can change from day to day and even hour to hour. And capacity also includes the ability to understand the nature and the effect that their actions have in a specific moment in time. Similar to the example I just gave, that during the day they may understand, yes, I'm in the hospital, this is what I'm here for, and I do want treatment. And then at nighttime, when their capacity fluctuates and perhaps diminishes, that might not be a good time for them to be making critical decisions for themselves. Competency, on the other hand, is a legal finding, and I think that's where it gets tricky for most people. Competency hearings are conducted to determine somebody's mental capacity, and they're often used to determine if guardianship or conservatorship is needed. So a family member or a friend would have to petition probate court, give documentation as to why this individual requires a guardian. So you'd have to have documentation as to why their mental capacity is diminished. And then there's a hearing set, and a judge hears the information presented and determines whether or not that individual requires a guardian. And that becomes important because it's not just simple medical decision making. They can make decisions about just about everything that has to do with that individual's existence. So I talked about this a little bit. I'd like to talk a little bit further, but where do you draw the line between that person's self-neglect, that they're just not able to care for themselves any longer, or their right for independence and to continue living independently? And that can be a very difficult decision. To help, you might want to look at some of these signs. Hoarding, failure to take essential medications or refusal to seek medical treatment for serious illness, leaving a burning stove unattended, poor hygiene, not wearing suitable clothes for the weather, confusion, inability to attend to housekeeping, dehydration. So for example, if you are a child of an elderly person and you just live down the street, and I check on my mom every day or every other day, and you're realizing that all of her pills in the pill sorter that you've set up to guard against this self-neglect, she's not taking them. Reminders, she's not taking them. She's not understanding what she needs to do from doctor's appointment visits. She's not bathing for days at a time, not feeding herself well, going out in the winter in sandals. Those types of things are clear indications that they are not able to take care of themselves any longer, and action really should be taken. So some of the statistics are staggering, but again, the reason why we're bringing this to your attention. 700,000 to 3.5 million older Americans are abused, neglected, or exploited each year. That's a very large number. For every one case of abuse or neglect reported, about 5 go unreported. Family members are the perpetrators of the abuse or neglect about 90% of the time, 40% being adult children and 15% being spouses. And again, these numbers being so high, referring back to some of the causes that we talked about in terms of lack of resources, frustration with the care, the burden of the care, all contribute to that. So what can we do to prevent this? So in terms of prevalence, once again, in care facilities, 1 in 3 were cited for violations. Residents, 44% of the time said they had been abused, 95% said that they had been neglected or even seen another resident neglected. 50% of staff have admitted to mistreating residents. 17% admitted to being pushed, grabbed, or shoved in a facility. And 51% report that they had yelled at a resident, 23% saying insulting or swear words. 7% of all the complaints regarding institutional facilities reported to long-term care were complaints of abuse, neglect, or exploitation. Though these numbers seem staggering, they may suggest, listening initially, that keep them out of facilities. That's not what I'm saying at all. Facilities should be treated similar to as you would with a daycare. You would visit them. You would go in unannounced. You would ask questions. You would check with other residents' families. You can go on michigan.gov. You can go on the website, and all of the licensed facilities have reports. You can read all of the complaints. You can read everything about that facility. So these numbers aren't to scare you, to say this is not a good option. It's only to tell you that it does exist and that you really should do your due diligence and do your homework and study the facility and get as much information as you can first. So with all of this seeming so daunting and so depressing, what can we do? Our hands are not tied. We certainly can step up and we can speak up. It gets a little bit confusing in terms of how to report and where to report. If this is a domestic situation, i.e. does not involve a licensed facility. For example, a family member, family friend who comes in 2 hours a day, anything like that where it's not a licensed facility, you call the Michigan Adult Protective Services hotline, 1-855-444-3911. That is a 24-hour number. They will prompt you with the information that they need, specifically the name of the victim, the address, whom they live with, and what the concern is and what the allegation is. And then they will assign that to an investigator who is an adult protective service worker, who will then investigate the best that they can to determine if this elderly person is in danger. If it is a facility, and a licensed facility, such as a nursing home or a long-term care facility, you would go through the Michigan Bureau of Health Systems at 1-800-882-6006. The investigation would be similar. They assign it to an investigator. They visit the facility. They look at the record of that person that the complaint has been filed for in behalf of, and they also will check with other residents and staff there to try and determine if in fact the allegations are substantiated. The other thing that you can do to prevent these things from happening and not have to go to the reporting route is frequent well checks. Whether that be you yourself as family member, whether you have a neighbor that can check, a church member, check on them frequently, because things can change from day to day. You may want to consider hiring a care provider. It could be somebody that comes in just a couple hours a day, a few days a week. It could be somebody that's there around the clock. Whatever the need is, there are care providers that you can hire if you're not in a position to always be there. And there's also geriatric care managers, and these often are licensed nurses or social workers. They evaluate and assess the individual needs, and then they coordinate the care through community resources. So they're kind of like the triage person and the captain of the ship. They make sure that what's needed and everything that can be put in place will be put into place. Some other things that can be done to prevent elder abuse is learn the signs of elder abuse and neglect. And hopefully today that will help. Call or visit the loved one regularly. Provide a respite break for a caregiver. We talked often today about the frustration that the care providers have, and they too need care, and they need to take care of themselves and give themselves breaks. Ask your bank manager to train tellers on how to detect elder financial abuse, so that the banks may get suspicious if they see an interaction between two people when somebody's withdrawing money. Everybody needs to have their eyes open to this. Talk to doctors about signs and symptoms of violence if you see that. You can organize community events to respect elders, posters, things like that in your community. You can do that through your church. And again, this is all just knowledge. Knowledge is power. Get the word out so that everybody has their eyes open. Volunteer to be that friendly visitor that comes in to the elderly and checks on them. And you could do an awareness day so that everybody is more in tune to this. I think the message is clear that it exists and we do need to do something about it. There's a reason they call it the circle of life. So as we start out as infants and babies and toddlers and need so much care and supervision, as we grow old, we circle right back to that, and oftentimes we are in need of those same warm, loving, caring hands and eyes and hearts. Thank you.